Well, March is Colorectal Cancer Awareness Month. The disease affects nearly 1 in 4 Americans. Dr. David Hiller with Novant Health Colon and Rectal Clinic joins us this afternoon. Thank you for being here. We appreciate you.
Thanks for having me.
All right, so who is at risk for colon cancer?
So everyone is at risk because colon cancer comes from polyps that can grow in any of our colons. And that's why screening is so important. Specific people at risk are ones who have family history or certain genetic predispositions. And that's why it's so important to know your family's history in addition to talking with your doctor and having screening at the appropriate times.
All right, so when do people need to begin those screenings?
Screening should start at age 45 for someone without any major risk factors or family history. And that's with colonoscopy at age 45. Used to be 50, now it's come down to 45. And if you do have a family history of someone younger than the age of 60 with colon cancer, you should start 10 years before their diagnosis.
Oh my goodness. All right, so now what else can people do to lower their risk factors?
Big things for lowering your risk factors are eating healthy, maintaining a good weight, not being overweight, a healthy diet full of plenty of fruits, vegetables, not a whole lot of processed meats and fast foods to have good colon health.
So talk to us about the symptoms or warning signs that people should know about.
So the big thing is that a lot of symptoms aren't really there initially when these polyps are forming. People will notice some blood with bowel movements, perhaps some abdominal pain, weight loss they can't explain, but a lot of times there are no symptoms, and that's why screening is so important.
All right, anything else you would like for people to know?
I think just make sure that you know your family's history. Make sure you talk to your doctor about it. A lot of people don't like to talk about it because it can be an uncomfortable topic, but it's so important. And as you said, it's so common in America. And so we just need to just feel comfortable asking questions and speaking up about it.
All right, good stuff. Thank you so much. We appreciate you.
Thanks for having me.